Okay. Good evening once again, everyone. We are welcome to this month's edition of our ARD webinar series, which is titled "Love Your Eyes." Welcome all of us that have joined, and please kindly send reminder to other of our colleagues to join this important discussion. So like I was saying, once upon a time, a resident went for an exam, a classified exam, and not up till then, he realized in the exam hall, and that was the end of the exam for him. So we have many residents who have, come up with many issues like this that have to do with their sights, maybe due to prolonged reading or excessive reading. And then we will not know we have eye issues until maybe whenever we are going for really use our eyes, then we realize we can't see very well. As we age too, eye problems, look for ways to set in. So today we'll be listening to our guest speaker who will be discussing with us eye health problems and the risk factors among medical practitioners and how to also solve this problem. We want to thank our guest speaker in a special way for giving us this occasion to discuss these issues, and we hope that at the end of this program we'll be also how to solve. Introducing our guest, he starts. Our guest speaker today is an alumnus of Obafemi Awolowo University, where he had his primary medical education, and then he also had his residency here in the teaching hospital. He is a fellow of both the West African College of Surgeons and National Postgraduate Medical College of Nigeria. He is the General Secretary of Ophthalmologist Society of Nigeria, Osun State. He is also a senior lecturer at the Department of Ophthalmology, Obafemi Awolowo University, and a consultant ophthalmologist at the Obafemi Awolowo University Teaching Hospital, specializing in corneal and anterior segment diseases. Of no other person, Oluwaseun. Thank you very much, sir. Resident doctors, and we hope we'll be able to grasp in all what the risk factors are and we'll be able to solve them. Thank you very much, sir. You have the floor.
Thank you very much, Dr. Uria. And I would like to state that I'm quite honored to address all of us today on this important topic of the eye health, especially focus on risk factors as they affect us as medical practitioners. I would like to share my screen here. So thank you very much. The topic that we'll be discussing this evening is about love your eyes and how we can address risk factors and eye problems among medical practitioners. And I would like to start with this quote that says, the author is unknown. It says that I love your eyes, but I love my eyes more, because without mine, I can't see yours. And I think as we go ahead with this presentation, we will realize that that is how we need to love, how much we have to love our eyes, as much as we love others, we need to love our eyes. So our discussion, this presentation this evening, it's not essentially we're not talking about all the various diseases of the eyes, because I believe as doctors, we are like people in the society, we stand about the same level of risk of developing eye disease in the society, but we are looking at it as medical professionals. How does our eyes, how does it affect us? How does our work affect our eyes and our eye health? And I'll be using the outline to introduce briefly, talk about the objectives, and we talk about general challenges to our health that medical practitioners face, as well as we also look at the various specialties because we all differ. We kind of circumstances we're exposed to, talk about the preventive measures as individuals and make certain recommendations. Yeah, so in essence, in our eyes are actually one of the most important organs in our body. And oftentimes I tell medical students that after the capacity of your brain, the eye is probably the most indispensable part of our bodies, that helps us to function, as doctors. I mean, you could imagine how easy or difficult it would be to function without the eyes, I mean, compared to other sense organs of the body. So therefore, as medical practitioners, I mean, our eyes are quite important, and we depend on it. And we also require the nutrition and the support that it offers us. So it is therefore crucial that we understand and mitigate the risk factors that will impact our health as we work as doctors and we take care of patients. We should also prioritize this concern our health as individuals. So despite note that despite our knowledge about our health and high health, medical practitioners often neglect their own eyes. And oftentimes they attribute this to busy schedules and the high workload. I mean, and oftentimes we have had to manage some doctors in which, coming much late in the state of certain conditions, I mean, we now present to the eye clinic. But in essence, our objectives are essentially two. First of all, is that we want to raise awareness about the risk factors and eye health problems that medical practitioners face that is peculiar to our work, and also to provide practical strategies to help to protect and maintain good health so that we can continue to provide optimal patients care. So now we could look at what are the general challenges that we face as medical practitioners. And then that as practitioners, we stand to face certain unique challenges that impact our eye health. As I said, I won't be talking about those issues about cataract, glaucoma, all those things. We are looking at the medical practice as how it affects us. One of the key things that actually features of our practices that affect our eyes is first of all, the long working hours that we tend to have as medical practitioners because we have long extended working hours, overnight shifts, calls 2 weeks call back to back, and things like that. And then this often leads to a lot of eye strain, fatigue, and discomfort that many people tend to complain of. But sometimes some of them never really seek any intervention concerning such. Another thing is that because of this era that we have, we depend a lot on a lot of electronic devices, computers, tablets, smartphones, for research, for documentation, for presentation that we are doing today. So oftentimes it causes a lot of some people experience some what we call digital eye strain. Also, which has been given a name called computer vision syndrome. We're looking at how that would affect us as doctors as we go on in the course of this presentation. Another thing again is the lack of breaks. We oftentimes as doctors we work from 8 to there is no closing time for some of us, and then there are hardly no breaks, not even institutionally accepted breaks. For us to to relax and also get to refresh ourselves. So this all these things tend to affect our eyes and cause a quite considerable amount of strain on us. Now, again, is which many of us will probably be able to relate to very well in our hospital, particularly in the developing world. That is whereby lighting is poor, in consulting, examination room, in the operating rooms, and so many of you out of service and then and this often causes us again oftentimes the challenges that we have with our eyes and in fact our body generally actually has to do with the air quality there of where we walking. And we're going to be talking about some other things, how it can affect the eyes as part of the body, and also something we call the sick business about that. Then another challenge that we tend to see generally across board, across specialties, is there lack of use of eye protection by medical practitioners, and this will pose significant amount of risk to us, particularly use of goggles, face shield by those who conduct procedures and surgeries. That's generally about what are the risk factors, things that threaten our eye health as medical practitioners. But again, there are specialty-based challenges that we tend to face that may differ from one specialty to the other. We all don't seem to face exactly the same kind of challenges. So we're talking about it specialty by specialty. I'm sorry, I try to talk about a few number of specialties. I might not talk about yours, but you might be able to relate more with, and some of them I relate more to you, and it's not going to be any particular order. So, but I know there will definitely be some other things that I don't have on my presentation here that you will easily relate to, and that also you think might be actually one of those eye hazards that you face your specialty. So, first I'm talking about surgeons. When I talk about surgeons and procedure specialists, that talks about both general surgeons, plastic surgeons, the urologists, the CTSU. Talk about the dental surgeons. So of course, across board the orthopedic surgeons. So essentially, they tend to work in the operating room, and they will work in the operating room. You have the operation lights, which is a dry surgical light, and sometimes some surgeons reported that about 5% of surgeons do complain of eye strain, after leaving the operating room. Some people experience a lot of glare because of reflections of light into their eyes, either from their instruments or even from the surgical site, and gives them a lot of discomfort. Then because of different light illumination intensity in different aspects, on the field and also on the scrub trees, you have different lights that can become challenging that some doctors tend to experience. And sometimes this could lead to sometimes medical errors. Sometimes you have the lights in the theater dimmed because and it kind of makes it difficult to read off something. So that's some of the challenges that we face that has to do with our eyes when we work as doctors. And we know that some of these illumination that are being produced that we use in theater actually contain a wide spectrum of lights, or the light spectrum. You have the visible light spectrum, you have the ones that are not visible, the infrared and the ultraviolet. And we know that some of these lights actually cause some possible damage in the long term to the eyes, particularly the ultraviolet components. And we really can't guarantee whether some of them actually have actually low on this part of the light spectrum. So in light, some illuminations that have a lot of UV light can actually cause a lot of cumulative damage to the retina. It can even induce cataract formation. And also, that ultraviolet light has been implicated in the formation of pterygium. So this could be one of the risks that we tend to face day to day while doing our work as doctors. Even infrared lights, also because of the heat generation, will also cause some considerable damage to the cornea and things like that. Then also, in some theaters, the ultraviolet lights, actually lamps, are used to disinfect, theater spaces and some spaces that we use in the hospital. And we know that UV lights are actually dangerous to the eyes. And normally, those lamps are not supposed to be on when people are in theater. It's when the theater spaces are closed, that's when those lamps are actually made to come on. And sometimes, inadvertently, some of these things may be left on, so maybe perhaps because of new staff and things like that. There was even a report about a theater session, a neurosurgical session. All 9 surgeons that were in theater on a particular session, within 1 to 2 hours after surgery, they started experiencing severe eye complaints that even required 1 or 2 of them to be admitted. And it was later discovered that the UV lamp was actually left on while they were having surgery and things like that. So these are some of the risks that we could face as surgeons, that which we may not be aware of before now. We need to really, be very conscious of in the environment, and this will cause considerable both short-term and long-term challenges for us for our eye health. And again, the surgeons too tend to face injuries, risk of eye injuries from sharps, and also contaminated fluids, body fluids during procedures, and the eye protection devices are one. And studies have shown that sometimes the utilization of these protective devices is quite low among our surgeons, about less than 10% of surgeons do use. And studies have also shown that those who use, more than half of them actually have contamination of the protective eyewear, meaning that if they had not worn it, some of these eye fluids would have actually come in contact with their ocular surface. And this tends to be more in patients in longer surgeries and those who use power tools, like in orthopedic surgeons that use brace and all sorts of things. And then another study that was done by the Silva et al. Showed that in 45% of those who use the visor, that is the face shield, also, it also add the blood splash, and they were macroscopic. In more than about 68% of them are macro splashes, and 70% add only just a few. But sometimes we tend to feel, oh, no, there's really nothing, but really, oftentimes we get inoculated with some of these body fluids from our patient, and we pose considerable risk, both lots of infection and other things to us, to our body and to our eyes as surgeons. Those who work in emergency medicine, many of us go to the casualty we know the nature of how casualty works in such an high stress, high intensity environment. And we tend to face a lot of challenges, because when you are on call overnight, you are sorting out patient here and there, you tend to lose your sleep. So because of the regular sleep pattern, of course, you often have people complaining of eye strain, fatigue and things like that, because of the nature of work that we do in emergency units. And also, because of procedures we need to do on an emergency basis, there are also risks of eye injuries from sharp instruments and also from contamination from body fluids, in emergency units. Also, because in our environment, issues of assaults is common, and it's probably becoming alarming, where because of the kind of emotional states of caregivers, of patients, you could attack doctors, and sometimes your eyes could be the eyes of the doctor could be the target. So I use some assault is one of those risks that doctors tend to face when they work in emergency units. The radiologists also tend to face some of their own peculiar challenges, particularly because they have to spend a lot of time on the examining films and digital images on screens. So digital eye strain, and also they tend to have eye discomfort and blurred vision. Then some of them that work in I'm talking of radiologists now, not just radiologists, but those including the imaging specialists, the radiotherapy, nuclear medicine, and the likes. Also, they could be exposed to ionized radiation, even though we know that there are some safe measures that will have been put in place, but we cannot say they are 100% foolproof. So, an exposure to such ionized radiations could increase the risk of cataract formation and other eye problems. And there are some of those radiations that when you are exposed to it for long enough, they could actually cause optic atrophy. And so those are some of the use. Then radiation and allergies from some of the radioactive materials that they are used will also pose significant risk to the eye health. Dermatologists, one thing, the dermatologists where they use lasers to treat skin conditions, and also for UV lights. Some of them use UV lights to treat some of these skin conditions. These lasers and UV lights also constitute risk to the eyes, the cornea, the lens, and also the retina. So these are things that they use, but they have to be careful, when using such. Then the anesthetists are also the theater specialists. They work in the ICU in theater and in many other places in the hospital. But one thing about, just like surgeons, they are also at risk of developing challenges from theater lighting, and also because of medical errors, because of different illumination intensities, whether dim or very bright intensities, all have their effect on the eyes. And also because of especially during long surgeries, long and intense focus on monitors, the monitors, the instrument, vital signs, we tend to experience a lot of eye strain, fatigue, and discomfort. And then also direct exposure to surgical light too causes them a lot of discomfort and dryness. Then some of the anesthetic gases that they also are exposed to also cause eye irritation, tearing, and sometimes even dryness. And sometimes they're also involved in providing anesthesia for patients that are undergoing some imaging procedures interpreting like the serum is being used, fluoroscopy and the likes. So they could be exposed to such analysis radiations that could endanger their eye health. And also, of course, because they also work with sharp instruments and things like that, just like the surgeons and those who work in emergency medicine, they also face considerable risk to to their eyes. Primary care physicians and also other office-based practitioners. Generally, we're talking about office-based practitioners like the public health specialists and many other people that tend to work more in the consulting rooms and office procedures. And in this era where many hospitals are adopting the EMR, the electronic medical records, where you have to use the computers and things like that. So there are also challenges with using a long-term use, very long periods with the computer usage, and also documentation and research. So you could experience some form of an eye strain, while working. For us as ophthalmologists, we tend to work a lot with a lot of bright lights at the slit lamp, in clinic, in theater, we're doing surgeries. So you find out that more than 50% of the time you spend in the eye clinic, you are examining using very bright lights, and some of these lights also, as I said, are not just visible lights, they also have the other spectrum of the electromagnetic radiations, and we cannot really verify whether the manufacturers actually have filters to filter away some of these wavelengths of lights that could constitute some danger to the eyes. And also we also face the risk, with handling some chemicals, intravitreal injections, and sometimes and also sharps too, and also infectious agents, because when you examine patients, you are just within about sometimes as close as about 5 centimeters of the patient's eyes. Sometimes when you have to examine with the direct ophthalmoscope, even with the slit lamp, just about 30 centimeters to the patient's eye. So we are also exposed to infectious agents through that means. The ENT and dental surgeons, both whether in the clinic or especially in their clinics this time, they also have a long period of intense focus and concentration when they are doing procedures in clinic or in theater, and this could potentially lead to some eye discomfort, some dryness, and also ENT surgeries tend to generate surgical smokes when they are working within the cavities, and debris. Sometimes some of gases are released that irritate the eyes and cause some discomfort. Also, they also work with microscope, like the ophthalmologist sometimes, and also they will also be exposed to potentially infectious materials from patients' airways, and things like that. So for pediatricians, for the neonatologists, they tend to, because of phototherapy that they administer to babies that are having high levels of bilirubin, they have some increased level of exposure to UV lights, and then they are emitted, apart from the normal one that many of us are exposed to when we look out, when we are outdoor from the sun. They also have, right inside the walls there. That's why babies actually have their eyes covered because of the damaging effect of UV light on the eyes, but the doctors, the caregivers are not protected. And then we really don't know how much of that they will get in their lifetime working as pediatricians. And this may actually increase the risk of cataracts and also macular degeneration, when you have some considerable amount of exposure to those lights. Then when you're also managing children, they're really not predictable. You want to get infectious, materials from children, can cause conjunctivitis and some other related infections. And so for laboratory medicine physicians, they tend to have quite a lot more exposure to things that will actually affect their eye health, from chemical exposures, that they deal with in laboratory reagents and chemicals, latex from the gloves, some pre-reactive latex. They carry the latex from gloves, so it causes a lot of irritation of the eye, infectious agents when they handle body fluids, and also which may contain infectious agents. Radiation exposure, some of these laboratory equipments actually use ionizing radiations, like the cytometers and the gamma counters. And if safety measures are not taken, they could have some significant amount of exposure to some of these radiations that could affect the eyes. And also exposure to radiations, could lead to cataract damage. And also mechanical hazards also occur because they use a lot of equipment with moving parts, the centrifuges and autoclaves. They could have a projectile, from some of these devices when appropriate safety protocols are not well followed, or damaged parts could fly off, and this could hit another part of the body, including the eyes. and then also some of them work with very hazardous materials that will endanger the eye. They also work with microscopes and a lot of light, you know, when they are working. The psychiatrists, so that we don't leave them out there, they also experience some considerable amounts of risk with the eyes, like when you manage patients with aggressive behaviors, you know, the patients could just target the eyes of the doctor, and so it's a possible risk that they experience. Now, how do we address these eye health problems among us as medical practitioners? Now, I would say that there are personal measures that we need to take, and there are also the institutional interventions that need to, that needs to be put in place, or that needs to be reinforced so as to, mitigate against eye health hazards amongst us as medical practitioners. Now, what are those personal measures? What can they address? My personal measures can address things like the digital eye strain when we use computers or digital devices, and there are things that things that cause that triggers or worsens dry eye. Things that cause infection, eye infections. The personal measures that we should be able to take as doctors. Then also some optional eye injuries. You have your own level of responsibility that you need to ensure to be able to prevent or things like optional eye injuries that will occur from assaults or from equipment that we use as doctors. Then also it's very important that many people do have a lot of pre-existing eye problems, including refractive error. Some people have presbyopia, and then which will actually affect their functioning as doctors. I mean, as resident doctors, we do a lot of reading. Even non-resident doctors still do a lot of reading, and then sometimes we have things with reading, or even reading of some of these are labels on medications. Actually, people that are approaching the age of 40 and above, I mean, they are likely to have presbyopia difficulty with reading fine prints. So they need to address some of these things that could, so we don't get to endanger ourselves and our eye health. Then there are other conditions, glaucoma, like you have every other person in the population. Some people have allergies which they need to address, and will actually be worsened by their work environments, which they need to take care of. Now, what are the things that the institutional intervention we need to address are things like the infection control measures, also issues that have to do with optional injuries and putting protocols to prevent, assaults, in the hospital environment. The issue of hospital indoor air quality, we really don't pay much attention to this. And the issue of staffing, that will have to reduce the number of long work hours, and also to instill the issue of allowing breaks for us when we work as doctors. Then the issue of illumination in our hospital is really a challenge. Sometimes power outages and things like that. And also the regular education of all healthcare providers to help to foster a culture of eye health awareness. Now, we go specifically now to the issues that we can take care of personally, because since we are here as individuals, what are the things that we can do as individuals, as medical practitioners? One common thing that many people tend to complain of is because we use computers, we use laptops, we use tabs and things like that. A lot of people complain of things that has been described as a computer vision syndrome. It doesn't have to be a computer. So people complain of a lot of eye fatigue, eye irritation, breathiness. Sometimes they have this tearing, the eyes are still tearing, they have some occasional redness and burning sensation. Like they have this stabbing, sensation in the eyes, sharpening that kind of like the transit, headaches, even sensitivity to light. Some people can read at certain times of the day, because they're so sensitive to light, evidence in their eyelids twitching. A lot of them complain, once in a while about this. And that's why sometimes when people are about going for exams, that's when they start, running about, seeking one help or the other, or when they are writing because of the exam, they find it difficult to be able to cope and concentrate, and actually develop problems. And when you talk about computer vision syndrome, because of long-term, very prolonged use of computer, even musculoskeletal challenges also come, like neck pain and back pain also come along with this. And just want to show you a video to just help us understand what actually happens, why we have some of these issues with the eye when we are when we have those challenges with eye. Now the eye is actually covered by what we call the tear film, which is like a protective surface. The tear film consists of about 2 or 3 very important components that keeps the ocular surface smooth and healthy and comfortable for us. We have 3 layers, the mucin, aqueous, and the lipids. They are all works together. And there's the lipid that is produced from the eyelids that is only squirted out when you blink. That's why the issue of blinking frequently is very important to help to keep the surface of the eye covered and protected from the external environment. So the tearfilm kind of dries up and exposes the surface of the eyes, to the environmental conditions, and then causes some damage to the ocular surface, the epithelial cells, and exposes the nerve endings there. Sometimes the lacrimal gland produces some tears when you are emotionally unstable, kind of compensate for that. That's why you have some tearing. And eventually over time, the eyes kind of become a bit sore, inflamed. You have this redness that you kind of tend to experience, from time to time because of the lack of sleep, prolonged exposure of the eyes to the external environment, inadequate blinking, the work of computers and things like that. There's some things that will actually aggravate it, things like breeze, the temperature, the humidity level that encourages dryness, dry surface to dry up quite very fast. And then these are the things that we actually tend to experience in our environment when we work as doctors in the hospitals. And this will affect us. Sometimes you have to make a presentation that you have to spend a long time with the computer. There's lots of productivity, you have a lot of discomforts. And if this happens during the exam, it's fine difficult to be able to cope during exams. Now, we're going to look at when you come to the eye clinic, when you look at your eyes, sometimes there's some things we see that help us to know that what I was showing in the previous video actually is because of your surface. The surface of the eye dries very fast because of some of the risk factors things you are exposed to during your work. Now, sometimes when we put on the surface of the eye, we tend to put some dye, polyfluorescein on the eye, but to highlight the tear film. And when you put it, you're going to see that there's some black spots quickly appearing. When you blink, it's everything is becoming green. Later, you have some black spots appearing. Those are places where the tear film is drying quite fast. These are a very advanced stage whereby the surface of the eye is drying so fast in this patient. Just blink, but less than 5 seconds is drying up between blinks. And that's why what happens is that in such persons, you have something like this. Those dry spots eventually causes damage to the epithelial surface, causing what we call fluorescein staining. And these are things that they expose the nerve endings under the epithelium and cause a lot of sensitivity and pain and discomfort to the eyes. And that's what we see that on the cornea, on the conjunctiva, you can see some areas that shows you that the epithelium that have been denuded and lost. And you can see in this eye, you have the stains are taken up more in the lower part. And you have those dark spots, actually areas that the tear film is drying up quite fast in such places. And these are some of the things that we see in some of our colleagues when they come and complain some of these eye discomfort and eye ache when they come to see us in the eye clinic. And so now, how do we now mitigate against this thing? Because it's what many might experience at one time or the other, or might have experienced in the past. Now, the thing is that now we need to learn to be able to blink very regularly, very frequently, because it's good to keep the eye surface, well protected. And also, there's a rule of 20-20-20 that works quite well. And what the rule says that you look, every 20 minutes, you try to look up from whatever task you are doing, on the computer or whatever you are doing. For 20 seconds, you look at something that's 20 feet away for 20 seconds every 20 minutes. And then this kind of helps to quickly help you to replenish and keep the surface of your eye well and moistened. Sometimes when we work on visual display terminals like laptops and stuff like that, sometimes we do blink, but we don't blink completely. We just half shut the eyes, and some of the parts, particularly the lower parts, kind of gets, not fully covered. And that's why on the previous video I showed you on and then the illumination within the room is dark, and there's so much difference between the brightness on the screen of the system of your phone and that of the room, and this causes a lot of discomfort. And that some of our skin actually emits what we call the UV light, the blue light, kind of penetrates more into the eyes. It is a lot of accommodation and discomfort in the eyes, and that's why some of these devices are actually being installed with filters that you can use to reduce the blue light in your systems. And also in some of the phones, you have some of them, they have what called the eye care or the blue light filter. This could actually help to give us much more comfort when we're using our devices. Then also, so we need to ensure sometimes also there are some software that we could also install, to make us much more comfortable with this. Now, sometimes also it's important that we also ensure that we have a practice good sleep hygiene and reduce screen time. You know that they believe that the blue light tend to affect the melatonin that is helped to regulate our sleep wake pattern. And then when you are exposed to the screen light for quite a long time, it tends to alter our sleep and wake cycle. And then so it's good to have a very good good sleep hygiene. I mean, certain times you do the work, sometimes you have to just get yourself to sleep, and wake up and go ahead with the work. And sometimes some of these things may not work well enough. You might actually need to use what we call the artificial tear eye drop to keep your surface of the eye well lubricated, because you need your eyes to work as a doctor and also for your comfort. Then some of us, will also wear some spectacles that help to reduce the breeze and the flow of air across your face to reduce the amount of dryness you tend to experience from time to time. So appropriate spectacles will be needed. And for people that have refractive error or have pressed myopia, it's important that they go to eye clinic, get the appropriate spectacle prescription for them to use, that to be comfortable, doing their work, and also be able to minimize the effects of the long-term exposure of the eye to the environment when they are working, especially when you're working with digital devices. Then also another thing we also don't pay attention to is our work environment, the air conditioning and the humidity level. I mean, that when sometimes we use air conditioners, and that sometimes we get our skins get dried, because of the air conditioning system tend to reduce the amount of water in the air, and it increases the tendency for water to dry from surfaces, and this tends to affect our eyes. And so you need to look at your air conditioning system. Sometimes the air conditioners have settings that reduces water content in the air in your work environment, or those are increasing it. When you are working with a lot of air conditioning, whereby the humidity level reduces so much, then you are likely to have more symptoms and challenges with your eyes, eye discomfort. And so that is why you need to look at that. And also, again, is the issue of you facing breeze, windy conditions, like facing the air conditioner directly or fans blowing directly to your face. It kind of moves the flow, or increase the flow of air across your face and makes the air surface to dry very fast. And that's why sometimes after maybe driving for a long time, the air conditioning facing going to their face, they tend to have a lot of eye discomfort and pain, or maybe after work. I see a lot of bankers come, to see me complaining of when they close from work, and because they're always in air-conditioned rooms, from morning till close of work, and they have this kind of redness and soreness and sensitivity in their eyes because of the way the work environment is structured, particularly the humidity level and level of air conditioning. Now, there are other general personal measures that we need to take as medical practitioners to make us comfortable and make our eye health to optimal level. Now, of course, I talked about the issue of maintaining good healthy sleep patterns. Then, if you have medical conditions, health conditions, you need to be on top of that. Then it's important to also go for regular comprehensive eye exam. Oftentimes we do not comply with these as the practitioners, and we tell our patients to do this, but we don't do that. And because we are not different, we are not immune to diseases. We're not immune. We don't have a differential immunity compared to the environment, to the community. But now it's conditions like glaucoma, cataract, and things like that. We all have we live in the same world, so we need to get our regular eye exam done, and also particularly every 1-2 years before you're 40, and after you're 40, I think every year. And if you have family history of any eye disease like glaucoma, it's important you do your eye check every year, even if you're not 40 years. And also to practice stress management techniques that will help you to cope and do not expose your eyes to very adverse conditions. Then promote healthy life choices, avoid smoking, and some other things that jeopardize your immunity and health status. Then you also need to foster a culture of eye health awareness. You need to know your family history of eye diseases. Now, there's something I also want to mention, because in the last 3 years or thereabouts, this has been a major issue, the use of face masks. And then because we noticed just after the onset of the pandemic, there was an increase in the reported incidence of about dry eye, particularly people that were using face masks. And this was thought because when you normally without face mask, when you breathe, your airways, the air is just pumped right in the atmosphere like that. But because of the face mask, the airflow is now redirected, to kind of find its way to the sides of the top. And sometimes the air flow is kind of redirected upwards towards the eyes. And when the reduction of the air kind of increases the evaporation of your tear film, and oftentimes people were complaining of a lot of eye irritation and inflammation during the onset of the COVID-19 pandemic. And some of us still wear face masks. So I'm sure some of us might have had some experiences whereby you start having some soreness, redness in your eyes after wearing face masks for quite a while. And the study was conducted, it was found out that about 18.3% of people actually reported this during the pandemic. And then, so the thing is that you need to also consider how you wear your face mask. Does it leave a lot of gap in between your nose bridge and your maxilla? This will cause indirection of air towards your eyes, and you start having some complaints because of the wear of face mask. So you need to ensure sometimes you have to tape the face mask on the upper part so as to reduce the damage. You actually use some lubricants to use. Then it's also important to practice some breathing exercises. Another thing that people also look for, those who wear glasses, that when you wear face mask, especially when you wear it inappropriately, you will have the misting, on your spectacles, on your glasses, and this will cause, accidents and issues while walking. So it's important that when you wear your face mask, it should be well fitted over your nose bridge and should be under. In this case, this person was wearing it. The face mask was covering the lower part of the spectacle of the glasses, so definitely the air was going right under behind the glasses and causing mist formation. Whereas in the second picture, you can see that the face mask was well properly well fitted over the nose. So these are some challenges that sometimes we face as doctors, when we wear face masks, particularly after the pandemic, and we don't know whether it's be done down soon. Now, another thing we also don't pay attention to, which we used to note in our environment, is there's something we call the sick building syndrome. Now, the sick building syndrome was developed by WHO to be a condition in which those who live or work in a modern building, they tend to suffer from symptoms such as headache, fatigue, lack of concentration, and irritation of the skin and mucous membrane. And then the mucous membrane, the eyes happens to be probably the second most exposed mucous membrane of the body after the airway. So they tend to have some of these complaints. And we know in our hospital where a lot of buildings are being built, new buildings, old buildings here and there. And then sometimes we have people complain of particular symptoms, particularly when working in a particular building. And usually the complainants often report when they leave the buildings. And the eyes, sometimes some of those complaints have to do with the eyes. And so some of these buildings have their air conditioning system, maybe the source. Sometimes they have some what called volatile organic compounds. Some of them, the paints that were used to paint the walls actually may be the allergen, kind of causing a lot of discomfort for those who work there, live there. And we need to pay attention to this. Some people may have their own personal issues, like allergic conditions that are aggravated by working in such places. Some of us may relate with some of these things that you notice that when you go work in a particular location or place, you have some discomfort, some complaints about that place. Sometimes the paint, the asbestos, the cleaning solutions that are used there, the dust and fragrance, those may be the source of irritation for us when we work in such places. And we need to call the attention of authorities to some of these things, because if its environment must be optimal for both the patients and also the health workers. And then we need to look at this quite well. Now, a study was done in a hospital in Turkey, and they found that almost about 10% of patients, that complain that this sick building syndrome actually complain of itching or irritation of the eyes. Other things are fatigue and things like that. So oftentimes when you notice that when you work in a particular place, you have some of these symptoms of itching, then you need to consider there must be something in that building that might be the cause of your eye complaints, or even your respiratory tract issues like swollen nose, stuffy nose, cough, fatigue, and things like that. And we need to start looking at this and put attention with the authorities on these issues. Now, just go ahead to make certain recommendations about what we can do, what we should be doing to kind of prevent or mitigate eye health hazards that we face as medical practitioners. The issue of personal protective equipment cannot be viralized. We need to be trained on how to, access must be Then we will be training on how to use such that the goggles will face shield for our surgeons and people that work with procedures that are hazardous, like even in the laboratory. Then the eye hazard, we need to conduct a comprehensive eye hazard assessment in all healthcare. Not only the eye, general hazard assessment, but because I'm talking about the eye in this case, I'm talking about the eye. So we need to identify those potential sources of eye hazards, chemicals, infectious agents, sharp objects, and relations in our environment. And we need to regularly review and update changes to reflect the practices, or those equipment to minimize those two. Then the training, regular training and education of health workers on eye health and safety is important, including the proper use of eye protection devices, and also this will include registration of new staff to reinforce, and for old ones to reinforce ongoing training programs on how to handle some of these equipment and the hazard that they constitute to the body, including the eyes. Then our workstation, the hospital is going towards use of EMR. The ergonomics and the workstation design needs to be properly considered to ensure that the computer screens are high friendly and they are placed in such a way that there is adequate lighting, proper setting of the screens, and regular breaks to reduce prolonged exposure. And also, eye health promotion is very important amongst us as health workers. We need to prioritize our health, the regular examination, the 2020 rule, and things like that. So the hospitals needs to establish a reporting and response protocol for injuries, including eye injuries and eye concerns among the hospital, so that we can ensure appropriate medical evaluation and that treatment are provided in a timely manner. Also, policies, workplace policies, and that support eye health, that supports general health, safety, well-being of our staff is important. So that also, and some of the policies has to do with adequate staffing levels, reduce workload-related strains, and to enforce this issue on use of eye protection and to identify the hazards in a timely manner. The last and not the least is the issue of continuous monitoring and evaluation of health and safety standards. I'm focusing on the eye because the eye was talking about eye health. We need to develop a system where there's data collection, data reporting, and feedback, from the health workers. And then these are things that some of these things have to do with institutional reforms and then bring it to the attention. Oftentimes, in most part of our work, we do not do that. And then we need to actually generate data to support some of these things. And there are things that we need to do as individuals to be able to support ourselves and ensure that we do not continue to jeopardize our health, including our eye health as work as doctors. I would like to conclude on this presentation with the way I started, with the quotation that the source is unknown, that I love your eyes, but I love mine more. And because without mine, I can't see yours. So it's important that we love our eyes and we look and we ensure that as we walk, we kind of help ourselves to ensure that we get to have optimal vision, as we walk and help our patients. I want to thank you for this, for your attention. Please, thank you very much.
Okay. Thank you very much, sir, for that brilliant presentation. Fully packed with a whole lot of information. Thank you very much, sir. Okay, so please, for our participants, we are in the question and answer section. Please, let's kindly show interest when we want to ask question by raising our hand. We'll recognize us, introduce yourself, and you ask your question. We'll also take questions from the chat box in case we can't use the microphone. But anybody that wants to ask any question, please kindly raise your hand. We'll recognize you and you ask your question. Okay. From the chat box, there's a question that says, okay, specs is recommended for routine use. Is it all right to just order one without an ophthalmologist recommendation? Thank you, sir.
Okay, should I go ahead to WhatsApp? All right.
Yes,
let me just respond to that. Yes, with regards to use of anti-blue light spectacles, yes, they are good. They are protective, particularly with regards to the blue light that emit from the screens of the LCD screens, LED screens of laptops and things like that. Yeah, you could, if you do not have any eye issue, perhaps maybe you will be examined by the ophthalmologist, not have any refractive error, and you don't have any eye challenges, you are free to go ahead to get anti-blue light specs, to use. I mean, but the thing is that sometimes when people just go ahead to just buy it online, they are often non-refractory. They're just plain glasses, so they do not really address other challenges that the individual might have. So if you have a refractive error, the anti-blue light specs will not take care of the refractive error. It's only going to screen out the spectrum of light, that is the blue part of the light. That's all it's going to do. And you might have missed the opportunity to have your eye examined and be able to know what exactly is going on so that you can take appropriate steps. But if you don't have any issues with the examined, you don't have a refractive error, you don't have presbyopia, you don't have any eye issue of concern, then you are free to go ahead to get that.
Okay, thank you very much, sir. Please, do we have questions for our guest speaker? I want to believe we all have one burning question or the other to ask. Okay, another question on the chat box says, what is involved in a comprehensive eye exam, sir? I occasionally do eye checks in those World Glaucoma Day. Okay, sorry, let me read it again. What is involved in a comprehensive eye exam, sir? Though occasionally they do eye checks on Glaucoma Day. Are those similar to what is done on a regular eye checkup?
Yeah, thank you very much. Now, what comprehensive eye exam entails involves evaluating the structure and the function of the eyes. And then one of the ways we assess the structure of the eye, the function of the eye, is by checking your visual acuity. That is to see how well you are seeing. And then if you are seeing optimally, that's okay. But we also need to look at the structure. That is, have an examination of all the important structures in the eyes to see if are they within normal limits. I mean, they are appearing okay. So if there is any evidence of a functional deficit or a structural issue, then it will be appropriate, managed appropriately. Now, what we do on many of the World Glaucoma days or World Sight days and like that is that, of course, we check the functional states and we also check the structural. But sometimes, because of the limitation that some of those days do offer, you might not be able to go all the way in terms of assessing the structure and function. Because if you happen to examine the eye and you find one or two issues, then such a person will have to be referred to the hospital to go for further evaluation. But when you are checked, the function and the structure have been checked and they are okay, they are within normal limits. That's okay, that's fine, no problem. Just make sure you do another one at the regular time again when the next opportunity comes. But in the eye clinic, whenever we see you, we of course check the structure, the function and the structure. And if there are issues, then we will actually be attended to right there in the eye clinic. But if you are seeing like on an outreach basis, then but if there are issues, you still have to go to the hospital to go for further intervention and or further evaluation. I think there's another question that came earlier than that. That's the question says that I see a lot of people, even on social media, doctors talking about this anti-blue light specs, orthocomic or something, those ones that have green reflection. Yes, of course, people they will talk to you about anti-blue light specs because of a lot of use of visual examiners, laptops, palmtops, phones. A lot of people are complaining of discomfort. So of course, people will latch on such opportunities to market their franchise. But the whole truth of the matter is that somebody with eye discomfort may not actually be just the blue light that is giving the patient the discomfort. If the patient is having refractive error, presbyopia, and he goes online, just buy the blue light specs and thinks it has solved his problem, I'm sure that person will realize that that's not going to work. So buying those things will not, without having been properly examined, you'll have missed the opportunity to actually identify if there are other issues in the eye. Now, the issue of photochromic lenses is that photochromic lenses are actually specially made lenses that helps to kind of, they actually light reactive, they tend to react to the UV lights from the sun, actually some spectrum of very bright light that comes from the sun, the UV light. So what happens is that when you are in outdoor, it kind of darkens. So it kind of reduces the amount of light that gets into your eye, so you don't get too much light. So for people that are light sensitive to bright light, particularly to sunlight, they will benefit from photochromic lenses. But when they are normal indoor light do not respond to photochromic, to not darken when they are because the spectrum of light does not react. The lens doesn't react with that. So so that's the thing about photochromic lenses. It works for more of outdoor activities than for indoor. Now, somebody also talking about the green reflection. Now, there's something also put on many lenses, like photochromic lenses. We have what's called the anti-reflection. Because it was found out that many patients, when people wear glasses and they want to take pictures, sometimes there's this reflection that comes from the lens, goes back, to such pictures and things like that. So there's a technology that was that was employed that can be applied to lenses so that it kind of takes off the reflection, like the glasses reflecting back. You will see from the picture that I displayed from this picture on my slide there, you can see the lady wearing glasses. Even though you could see that her face was shining and reflecting back, the glasses wasn't reflecting back. It's because she has what's called the anti-reflective coating. And sometimes it has this greenish tinge sometimes. So that's what the greenish thing does. Though it also helps to reduce part of some dangerous spectrum of light and light electromagnetic light wavelengths. So kind of has some protection from UV protection and also kind of reduce the reflective. But all these things does not take care of issues that are actually within the eyes that refract error and things like that. They're just additional things to just protect the eyes from long-term damaging effects or some dangerous spectrum of visible and invisible light.
Yeah, thank you, sir. Another question on the chat box. Nowadays, we use virtually white bulbs. Are these not contributing to eye problems? Then the second question, we use computers and phones regularly, even at night. How do we reduce eye problems?
Yeah, thank you very much. The issue of the white bulbs, yes. And that actually been a lot of concern. But well, for now, scientists have raised the issues that the white bulbs tend to have different. Actually, they have a wide range of light of wavelength. The one that is usually of more concern is the blue part. That is the ultraviolet and the other ones. Those are the things. Some of the bulbs. We can't really guarantee that they do not have, we do not know to what extent they have these UV lights. And I think the jury is still out on whether they could contribute to damaging effect to the eye in the long term. But the thing is that we know that the amount of UV light they have in the short term, except somebody goes very close and stares at them for a long time, we believe that because of the distance one of us are to it, the short term impact is not as much for now. But except you go very close to that, then you have some of those effects on the lens, the cornea, or the retina. But usually see out whether in the long term this might contribute to increased incidence of cataracts or macular degeneration in the future. And then though some of the manufacturers will tell you that they've examined their products and then they know that they'll be able to put some screens or filters there to take out some of these dangerous parts of the light spectrum. And I think about the use of phones and computers at night. Yes, I think I kind of addressed that a bit in my presentation about ensuring that the illumination, there's no too much differential illumination between your computer and your environment. So using those computers and phones at night, you need to put on your filters. You need to sometimes the phones have blue filters. Some of us like to have the vivid pictures and all those things. But when you have filters, or you have something that can help you to take out some of those UV lights, that would be good because you are using these devices at very close range, and you could be getting considerable amounts of UV lights exposure over a period of time, and then that's in a way. Then again, the blue lights also we know that affects the kind of induces a lot of accommodation. Because the way the eye deals with it, because it focuses That's why a lot of people have some kind of eye strain or ache when they use phone at night, because it induces a lot of accommodation and kind of discomfort in them. Then some people have actually linked it to more incidents of dry eye. I mean, you don't know how it works on the cornea. Sometimes, because when you use this device for a long time, because of the rapt attention you are paying to that, you would not know that you are deliberately, you are involuntarily reducing the frequency of your blink that helps you to renew the tear film on top of your eyes. So you see people after using the computer overnight or the things like that, and because of the long time they use it, then they start having eye ache and soreness of the eyes after using that. So you need to ensure that you don't use it. Using the dark isn't very advisable. It's important, good that you also have a background illumination that kind of helps your eyes to be able to have a better balance with light appreciation.
Thank you very much, sir. Okay, another comment / question. Thank you, sir. It seems these eye hazards are more serious than we take it. Several residents cannot drive at night because they will complain of not being able to. Okay, hold on.
Yeah,
able to see when vehicles are incoming on the glare you mentioned.
Yes. Now, why many people cannot drive at night when they face very bright lights is that the effect of the glare. Now, if you have any distortion within the media of your eye, whether from the cornea to the lens down, if there is any distortion or opacity, then you could have a lot of scattering of lights, and you find it difficult to be able to cope well when you have bright lights. Now, the thing is that, of course, dry eye could contribute. And some people may have some different levels of opacities in their lens, varying degree, that makes light to scatter, and they could not cope very well. And sometimes some people actually have some form of refractive error. There's something we call night myopia. Now, when you have a very low bit of myopia at night, because of the dim illumination in your immediate environment, the pupil tends to dilate, and usually the eyes find it more difficult to undo, to resolve images when the pupil is wider than when it is smaller. So definitely you have a lot of light entering to your eyes, but they are not sharp, and you find it difficult to drive at night. For such individuals, they might need some, they need to have their eyes checked to be sure they don't have refractive error. Then they also may need to wear some what we call some anti-glare spectacles. There's some glare spectacles that could kind of cut off some light. The idea is to wear the tinted glasses, which will reduce the amount of light coming to their eyes, so that their pupils can cope much better with that light that gets to them. And also they could have some night driving glasses that helps to kind of reduce the amount of glare. They have some anti-glare coatings. When you see the eye specialist, they could advise you properly on that, so that they could use that when they are driving at night. There are some that you can actually wear on your normal glasses, and you can put off during the day and wear at night.
Thank you very much, sir. Sir, my own question. You made mention of micro and macroscopic splashes. Please, sir, what examples, what kind of examples are those? Not clear.
Well, I think the study that was done, among surgeons that were wearing eye protection when doing surgeries, and then there are some splashes you will see on glasses that could be very obvious to the eyes. Anything depends on the resolution of your eyes, and they probably have their own criteria. I mean, so what they did was to do a count of the stains, just by looking with the normal eyes, and they put under the microscope to see if there are other ones that they could see, without that they could not see with the normal eyes, and that was done by microscopic and microscopic. So the one that they had to use either a magnifier or identify with I think they use magnifier, to be able to see. That's what they call microscopy. So just highlight the fact that even the fact that you wore glasses and you not see anything, and you feel this surgery can go on. Actually, next time wear without glasses does not mean there are always aerosols that are generated from the surgical field, that could kind of deposit on your glasses. And
Okay,
if you are not wearing any eye protection, whether it deposits on your cornea or your conjunctiva, and you could get infected. Perhaps you are working with septic patients or patients that have some infectious diseases. So just to let us know that it doesn't have to be only cases that are not necessarily so bloody, but every source are related as surgical fluids, and we could get contaminations from such in our eyes.
okay, sir. Thank you very much, sir. We are very grateful for this. Please, any other question? Okay, yes, there's one more question. Thank you, sir. Could you shed more light on IPC?
Well, IPC is it laptop? Is it personal computer installed here, or what's the IPC? I don't know. Or is it PC?
Thank you, sir. I was trying to make it sure. So you mentioned something about infection prevention, infection control measures. Because I don't know what came to my mind was possibly maybe someone in the theater, and then maybe they want to dap his eye, and they'll carry all those gauze or things and wipe the face. I don't know. I'm not sure of the context of the infection control that you mentioned. So I just want to get more clarity. Thank you.
Thank you. Well, infection control measures is actually very wide, and I think I talked about the personal and the institutional measures. The personal start from use of hand washing, use of personal protective equipment, including your eyewear, your gloves, washing and all those things, and and things like that, and other things that institution needs to do, providing water supply in the theater, in the treatment in various locations, and then many other measures that the students have to do, roles that they have to play in terms of the infection prevention and control. Then also wiping of door handles and all those things, because sometimes we get infection, like when you see sometimes people having conjunctivitis, the issue of Apollo that people complain about. Sometimes we don't, when people used to believe, is when you look at somebody that has Apollo. No, many of the times people have actually contacted this from surfaces, from door handles. When you have patient that pass through a particular door and use the same hand that you have touched the eyes to touch the handles or touch surfaces, and you as a doctor comes to touch it, then you touch your eyes and you get infected. So those are the main. Holistic is a very wide thing to talk about in terms of infection control, and it's not only for the eyes, generally for every infection, because I just focus on the eye, and so I can't go to the details of that. Thank you.
Okay, thank you very much, sir.
Thank you.
Okay. I want to say a very big thank you, sir, for your time and for the wonderful explanation on the risk factors associated with eye problems amongst medical practitioners. I think for all of us that are here, we have learned one or two things, and we'll know how to prevent eye problems in the future. Our lives are just starting, so we don't want to go semi-blind before we have good health. So thank you very much, sir. We are honored. Thank you for gracing this occasion. Thank you for giving us your time to discuss with us. We are very grateful. Thank you very much, sir.
Thank you. It's an honor. Thank you very much.
Dr. Martins, please continue.
Thank you, my Vice President One. Thank you for the beautiful anchoring and hosting of this program tonight. I also want to appreciate my trainer, my teacher, Dr. Oluwaseun O. Thank you, sir, for gracing us and giving us this opportunity to enjoy this wealth of knowledge and expertise tonight. We are very grateful, sir, and we hope that for the future occasions, so many other reasons, when we have to call you, you always answer us as you've done tonight. We pray that God will bless you for the time and for the knowledge with which you enrich us. To our wonderful audiences from OAUTHC, member of OAUTHC, we are very grateful for availing ourselves this opportunity to learn about the eye, so that we can know what to do, in order to love our eyes. Thank you for all these coming. This is the 4th edition. We know that listening to this webinar alone is good, but will not suffice. So as soon as we put it online, maybe on the cloud for us to access, please let's do well to go and also watch it and even share it with our friends so that they can learn from all these things that we've gotten tonight. I also want to appreciate members from sister association or even from ALD in other hospitals who have always been joining us since we started this webinar series. Thank you for the love, for the spirit of comradeship. We hope till next time, when we'll be having another beautiful event like this. I want to wish us an happy holiday, the Eid al-Fitr holiday, and wonderful days ahead. Thank you very much. God bless us all.
Yeah, sorry, before you end the meeting, hello, Dr. Martins. Hello. Before you end the meeting, permit me to recognize a couple of dignitaries that joined the call. The second vice president of NAD, Dr. Jumbo Nefio Kezikaya. You're welcome, sir. Also, the president of ARD, Lagos University Teaching Hospital, Dr. Kemi Abiloye. A pleasure to have you. And also other dignitaries from other centers, Dr. Sisio Gu, I can see on the call. Thank you for spending time with us, and we're glad to have you here.
All right. Thank you, everyone. I want to wish us a good night's rest, and let's enjoy the rest of our weekend. Thank you very much, sir. We'll bring this webinar series to an end. Good night, everyone. Thank you very much, sir. Dr. Awe, we are grateful, sir.
Good night.
Good night.